Telemedicine is what all of us popularly understand as digital health. Telemedicine was there even before the COVID. Today, it is basically consult that people do from home. So we have today for telemedicine a panel of two speakers from our side. Other than Mr. Ramdev, we have Dr. Rajesh Nandipatti. He is a healthcare entrepreneur. After doing his medicine from JJMC MMC Medical College at Karnataka, Dr. Rajesh pursued a master's in healthcare policy and management at the CW Post, Long Island University, New York. He worked very extensively in the healthcare sector across the US before coming back to India and co-founding a chain of healthcare clinics, primarily deploying telemedicine. I think he's the best speaker today for us on telemedicine. From Acme side, we have Mr. Jaya Vasanthalin. Jaya heads the Acme Digital Health Division. Digital Health is one more division that we have under us. He entirely heads this division. Though he's primarily in front, today he's taken the last session to speak on. He's a healthcare professional with an MBA in hospital administration, worked for over 6 years in healthcare. Software and research has been his prime interest. Over to you, Vasant, for taking it forward.
Yeah, thanks for the opportunity, Mr. Menon. And yeah, so like as we proceed, hope I'm audible, right?
You are audible. Yes.
Okay. Thank you so much. So as we all know, the telemedicine is becoming an enabler for healthcare access and affordability these days, and not only these days since COVID. So I'll just start with the small highlights of this telemedicine, and after that I'll be handing over to the expert we have. And so telemedicine has been of great help for all of us, and for many practitioners especially, and especially with patients, and it keeps many infections at bay. Telemedicine helps the hospital provide services even at any remote locations, where they don't have to go for each and every physical examination or for each and every follow-up. And telemedicine, because of the technologies that has been available, it has been also become very much affordable for the patients who are even at remote locations. Like they don't have to travel a long way, and also it has become most of a time-consuming, time-saving factor for them. And telemedicine, it also allows the doctors and nurses to evaluate and treat patients, without having to fill their space in their hospitals. And these technologies also can be set up in virtual clinics in communities or any EICUs, and even in a smaller satellite hospitals. So with this being said, I will just want to, Mr. Shankar, can you go to the next slide? Okay. Yeah. So what you're seeing is the Praxis report of the healthcare market. So it says that the Praxis report, it was given in the month of August 2021, and it has given a projection about the outpatient healthcare market in India. And on the basis of the annualized run rate, online consultation have increased from 1 million to 3 million by 2021 March. And this rise is still increasing and is more likely to cross 12 million by 2024. And in other words, 1 in 35 consultations will happen online by March 2024. So that has been anticipated, projected. And so thus health systems that are invested in telemedicine are well positioned to ensure that patients receive the care they need. The government is committed to providing equal access to quality care to all, and digital health is a critical enabler for the overall transformation of the health system. Hence, mainstreaming telemedicine in health systems will minimize inequity and barriers to access. And India's digital health policy advocates use a lot of digital tools for improving the efficiency and outcome of the healthcare system, and also lays significant focus on the use of telemedicine services, especially in the health and wellness centers at the grassroots level, wherein a mid-level provider or any healthcare worker can connect the patients to the doctors through technology platforms, providing timely and best possible care. With this small overview, I'd like to hand over to Mr. Ramdev, and thank you for the opportunity. Sorry, Rajesh.
Go ahead, Mr. Ramdev.
Yes, thank you so much. We talked about various other products in this journey. Those who are as a participant, thank you for listening us so long. I would like to ask few questions to Dr. Rajesh, and he is one of our brand ambassador for Tata Communication Global. He was and he is right now still in our journey for last 8 years, 7 years, even though we had a certain business change in our Tata Communication. So I wanted Dr. Rajesh to tell us few words, being a doctor, why you emphasize that telemedicine, while one question, while Dr. Rajesh was there with Glow Hill before COVID and now during the COVID era. So I would like to say what adoption was lesser in telemedicine and what made as a doctor to adopt this, sir? Dr.
Sure.
Rajesh.
Hello, Ramdev ji. Good evening, all. Mr. Menon, thanks. So, Ramdev, to answer your question, what changed pre-COVID and post-COVID is the acceptance of people about telemedicine, whether it's caregivers or care seekers, the patients. Unlike before, unless there was a need, acute need for teleconsult, which was primarily driven by post-care follow-up or for screening or CSR activities, there was no real drive for telemedicine. I think COVID obviously changed all that. But before that, I want to give a little quick 1 minute background about my experience with telemedicine. Why I am so passionate about telemedicine since my student days. Even with dial-up modems of 24K and 36K modems back in the old days in the 90s. No matter how many specialists there will always be an uneven spread of patients versus specialists. And tertiary care can never be enough. And the only way to get tertiary care real access and only way to justify a tertiary care specialist's time and expertise is through reaching out to as many people as needed in the places they are needed. And telemedicine is the only way back then and today and in the coming future and in the long-term future as well. Now, having said that, I've had my experiences with telemedicine in the US. We have studied the Australian and New Zealand models as well. Pretty successful ones back in the and even in the Midwestern US, even Utah and all those places south. They were all driven by the remote accessibility, right? The need for remote accessibility. Now it is no longer about remote accessibility. It is about patient convenience and doctor convenience. So back to what I was saying, the many platforms that we have experienced, I think Glow Heal kind of, without having to trump, even though I'm a brand ambassador for, self-appointed brand ambassador for Glow Heal, without having to trump its presence, this is as substantial as it can get in the Indian market and as good as any other international player in the market, the Glow Heal product. Mainly from the perspective of a robust IT platform and the bandwidth combined. I can probably count on my fingers how many solutions like there are available in the market. Maybe Ramdev can tell us if there's any peers for Glow Heal that combines both network as well as a robust software platform.
Thank you, Doctor. With that, I would like to just share a few slides and then we go back to the doctor with few more questions that I have and probably the team might also have it. Why do we need a wellness? Wellness, what is the purpose of being wellness and what telemedicine we clearly focus on? As I always say, doctors and clinicians requires a telemedicine to connect with this. The same way patient and right now being the corporate industry or it could be a retail industry need this. And for that particular platform, your telemedicine can one of a good tool that all the hospital and service care provider can take in. And the next is help, reach out. Most of the tool, the telemedicine can be used as tool to reach out most of the patient and the care workers can help to reach the rural through this telemedicine by giving them lots of work-life balance, and psychiatrist could be one of good, telemedicine is one of the tool for psychiatrists also. With this, Tata Communication provides a solution which thanks to Dr. Rajesh, who has used our platform. That's why he was giving us this feedback. But I appreciate there are many, earlier in 2014-15, there are many, there are very less telemedicine softwares made in India and used for India. But right now, being this pandemic, many providers are stepping into this particular business. While Tata Communication, being in network already, had data centers as a service already, managed and security service being provided for large corporates by Tata. So we would wanted to get into this. Why? The data security is a core component, which we as a platform, as a communication platform, and we also have a voice platform, we had a video platform, we have an SMS platform. This is what the core component for telemedicine. Along with this, GlowHeal as a product, which not just a software, which also plays a vital role in a clinical process. What does that mean for a doctor and for a healthcare workers? Does it captures relevant information? Does it make sure a relevant mandatory fields are there so that while patient registration, necessary consent, necessary payment, all cycle is taken care by this particular side of doctor while they're giving their prescription, while they're giving their summary of their investigation? Can they capture why it is mandatory? It is mandatory because it is useful for them. We also integrated SNOMED voice to text conversion for benefiting the doctors for an easy consultation. Our platform also gives audio, video, and a text solution. If a service provider wanted to create an what do you call that as in telemedicine as a command center, what they can do is take an entire solution from communication software and the technology through which we will be able to enabling them with the patient wherever they are, anywhere, any location they are, they can connect remotely to their hospital through a text, and they can do through a chat. They can connect through WhatsApp. When you say text, through a WhatsApp, chat through a relevant software that we have developed in-house, and then you have video and audio software. This particular software can also support various three components. One, a corporate care unit could be one of them. Another is home care, which is required because I still say during the pandemic, as our technology was not evolved, these house beds can be converted into an ICU, which was not possible during the COVID or before the COVID because our readiness was not there, but can be prepared right now. I would request all the healthcare industry to think of it. Continual monitoring through the wearable device, those patients who are going beyond or after the surgical. I want a doctor to talk about this particular continual monitoring for a second. Doctor, why continual care is required? A continuous monitoring is required for a patient who's going out. What psychologically or rather clinically, what is that important for both patient and hospitals and the doctors?
All right. So we can talk about from the patient perspective first. It's beyond debate that continued monitoring is now called continued care. You know, it's no longer like two different things. And continued care, it's a documented fact that the patient compliance increases drastically, and the treatment outcomes also automatically improve drastically because of continued care. So that's from the patient's perspective. From the hospital perspective, there are two things about it. One is the P&L and the other one is the NPS, right? The Net Promoter Score, the patient satisfaction. The patient satisfaction levels, again, this is also beyond debate. It's documented fact that both things go up if there is good continued care. And the best way for a continued care is to be available where the patient is, rather than get the patient to come to a physical facility, you know, queue up, wait for hours or travel for hours and all that. This is especially true in cardiometabolic ailments and post procedures, especially major procedures. Over to you, Ramdev.
Thank you, doctor. So along with that, we have talked about telemedicine. We have talked about the continuous care, why important. Is it a platform readiness is required? As we spoke, a platform readiness is required. Why? The platform can be, the policy of India created, or the Indian government has published a policy on telemedicine, which says that there are certain mode and methods a telemedicine has to be conducted. It also says certain drugs has to be prescribed using different modes. Certain drugs cannot be prescribed in any modes. Certain prescribed has to be in a physical mode. So to follow this, is it a duty of a healthcare provider? Is it a duty of a technology provider to enable them? Yes, that is where Tata Communication is coming with their duty to support healthcare system, to enable that by which they can properly follow such rules and regulation. And in future, any technology is getting migrated, it getting upgraded. Healthcare industry do not want to think about it. You can think about or focus more into your care for human, develop your clinical process, whereas we as a technology partner, I'm expecting other partners within this country, because we as a TATACom would love to serve India healthcare industry, but we are not that greedy. We wanted, and we are supporting other partners also to give our knowledge. We wanted collectively India become a digitalized. Why? It supports not just a patient, it's going to support the front engineer who has saved, who has served with a proud, with their all life and during this COVID. Thankful for them, but we wanted also protect them by making sure the data is secure. Your platform becomes a cloud platform. Whenever you want, subscribe, but use it. And when you do not want to take the data and migrate it to wherever you want, if you feel Tata does not providing a better service. So your product becomes plug and play model, right? With that, I'm handing over this.
I think we can ask Vasant if he has any questions of Dr. Rajesh or Mr. Ramdev. Vasant, you have anything still lined up among the ones you had?
Okay. So as we know, the telemedicine has picked up mainly during COVID. And what benefits do you see from it to make it last beyond COVID too?
Doctor,
Dr. Rajesh, I think, yeah. How do you see it going beyond COVID? Up, down?
So, yeah. So it's going to be a slow growth for sure, but regardless, it's going to be growth certainly. But before answering Vasant's question, I'd quickly like to make a point, like what Mr. Menon was mentioning at the beginning of this session. Telemedicine is no longer nascent. It's been around for some time. It has come of age, and government has, Ministry of Health and Family Welfare has launched telemedicine practice guidelines in 2020 August. March, right? March, it has released that, and then there is also some EHR standards that have been released in August 2018. Metadata and data standards. It is no longer a gray area, unlike, let us say, tele ICU, which is kind of in the forefront, still just emergent, post-emergent technology. This has totally come of age. When it comes to prescriptions, the government has clearly stated the guidelines. These are not mandated rules, but these are clear guidelines which can have an effect in any kind of legal issues that might come up. It has dictated a list of classified drugs as list O, list A, list B, and so on. And then there is a prohibited Schedule X drugs that Ramdev was mentioning. So this is about that. So to answer Vasant's question about what do I think is the future of telemedicine, it's rapid adaptation, like Vasant showed, you showed in your own slide, Vasant. But what is it that drives telemedicine in the post-COVID era? So I don't think there is going to be a post-COVID era, because COVID is going to be an ongoing pandemic, not obviously at this level of intensity, but it's life before COVID and life after COVID, as someone was mentioning in a BMJ conference recently. So people are going to be that much more sensitized for proactive, preventive healthcare, and that is what is going to drive telemedicine. Proactive, preventive healthcare. So all the wellness scenarios that Ramdev was showing in the earlier slides, the kiosks, the corporate screenings, those are the ones that are going to drive telemedicine. That is one. And the other one is, like I recently had a friend, a close friend, she had a double mastectomy. She got it done in Chennai, and she lives in some tier 2 town in Tamil Nadu. She came to Apollo all the way, got it done from one of the best doctors there. And what is the ideal way for that patient to receive all the counseling and support post mastectomy? Telemedicine. So as people get sensitized more and more about what they can get through remote sessions, pretty much every working, whether it's an employee or an entrepreneur, every working person today is now used to the kind of calls that we're making right now. That simply is a driver for telemedicine going forward.
Thank you. Thank you,
Thank
Dr.
you.
Rajesh.
Thank you. Thank you, Dr. Rajesh. Do you have anything or should we go into the Q&A panel? There are a few.
Maybe Mr. Ramdev, I think I can ask this to you. So like,
Yeah,
what
yeah,
about
go ahead.
what about the operational feasibility in remote areas where networks are not efficient for now?
I would, and if you ask this answer 4 years or 2 years before, I would also said that no, that is remote area we are not going up with. But being experienced with GlowHeal for 200 and plus sites, what we have learned here is the remotest area has at least a 3G or a 4G connectivity. With 3G and 4G connectivity, I'm sure we are able to connect. We have served. Were able to do 15 consultation along with telemetric device in a remoted place. One of a good example of remoted places where there was a farming area. In between, there was a pump which is used for agriculture pump. We converted that room as a telemedicine because that's the center for at least 5,000 people. Through a Ramakrishna mission at UP, and we have implemented telemedicine along with tower whatnot, where the monkeys etc. used to grab up. Along with the technology problem, we have animal problem to protect it from. So the learning, what I'm saying, network is no more a challenge. Being a lot of technology, the low site, the LEO satellite is coming in, 5G technology is coming in, TATA Communication ourselves is implementing a 5G as a private network. So we will make sure in another 8 to 9 months, the remote places have been taken care. Along with this, Reliance and other BSNL fiber. So network should not be a problem at all.
Your technology will also provide some sort of a booster or something in case it's low, because there could still be a village with
Yes, I
3G.
agree with you.
Yeah.
In the tribal area, one of a few cases that what we have done is there are two terminology that we call in. Our technology can operate with a low bandwidth, and another one is called offline online. What it does, when you go for a remote area for screening, and if you do not have the network facility, their absolute network, it's broad remote. I'm talking about tribal area. What we do, convert, get all the information, move to 1 kilometer, upload it, and then do a clinical research and go and give the prescription and the medicine for that. The second method is convert from a video to an audio mode automatically, and an encrypted mode by, or rather the convert most of this data all are text based, because the vital parameters goes in a very smaller size. The technology automatically adopt the network, convert the last video into a picture, so the patient realizes the doctor's picture is there, what he saw at the last moment, and then make sure the necessary data, your valid the clinical data is pushed and move back to audio video solution. That technology also been implemented in our platform.
Thank you.
Thank you, Mr. Ramdev.
Wasn't there anything else with you?
No, I think.
I have one quick point to make to answer Vasant's question a little bit further.
Yes, sir.
Ministry of Health and Family Welfare has also released this Ayushman Bharat digital mission. So this was in September 2021, barely, a couple of quarters ago, not less than a couple of quarters ago. The Ayushman Bharat digital mission is going to be one of the drivers for speeding up telemedicine adoption. Primary reason for that is any kind of remote calls have to go through a secure platform, data has to be recorded, stored, etc., etc. That's going to be pretty game changing, depending on how much the government drives, given that 80% of healthcare spending in India happens in the private sector. It's this kind of so I think this Ayushman Bharat digital mission is about something like they're trying to do a unique healthcare identifier along the lines of UPI. So
like your Aadhaar or something like that. It will get linked to your Aadhaar,
like Bharat Pay or
okay.
Something like that. UPI.
UPI.
Unique payer identification. They're going to get a unique healthcare identifier.
So
once
added to that, Rajesh, NHA, National Health Authority, is driving that, and thanks for bringing up that. Tata Communication is right now being part of that journey, and Tata Com is also a registered entity for NHA to ensure that all the service provider, healthcare service provider and application provider, make sure their platform is ready, right? Integrated and ready.
Yeah.
So fortunately we are working with NHA, we are making sure our platform is ready. So anyone who want to migrate and he sees that his platform is not comply with, immediately can migrate to Tatacom cloud platforms. Yeah, that's true. They are doing it. In 1 year down the line, it will be made mandatory.
Right.